From pills to pot, thousands of people have overdosed on opioids in Florida in the last few years, making it one of the biggest public health concerns in recent history.
And some doctors out there say that the new medical marijuana law could help lower the death rate out there. And as NBC6 investigator Dan Krauth shows us, even offer a safer alternative.
A new law went into effect in Florida this summer. It cuts down on how many pain pills a patient can receive and who prescribes them. It's meant to cut down on addiction and overdose deaths, and it could turn those looking for pain relief to medical marijuana.
This is a vaporizer.
Rosemary Masseri never goes far without one.
Press 1, 2, 3.
She's ingesting marijuana, not the traditional way. It's a vaporizer filled with marijuana oil.
One of the things that I've told my children, I cannot wait for the day for me to wake up and not have pain. And my dream has come true.
She says she was diagnosed with multiple sclerosis and was prescribed opioids.
You start liking it, and then 7 days later, you're addicted.
After breaking a leg and getting a bone infection.
I was waiting for those 6 hours to go by like this so I can have that other opioid. And that's how you get addicted.
But since getting her medical marijuana ID card last year,
the opiates are gone.
I think that it's a great alternative.
Pain management doctor Michelle Weiner says people like Masseri are part of a trend that may grow. On July 1st, a new law went into effect, putting a 3-day limit on most opioid prescriptions. It requires any doctor who prescribes them to record what they're prescribing in a statewide database and cross-check it for any other prescriptions the patient may be taking.
We've been getting more patients because a lot of physicians are concerned about prescribing opioids for a chronic condition.
She says more patients who use opioids are turning to medical marijuana as part of their treatment. She has 800 patients on cannabis.
Do you think we'll run into problems with marijuana like we have with opioids in South Florida?
Well, I think that because it has a safer profile, it's a better choice because the patient's not going to be able to abuse it to the point where they're dying or they're going through life-threatening withdrawal.
But she says some patients have a difficult time getting access to medical marijuana. The state allows it, but the federal government does not. Which means, unlike prescribed pills, cannabis is not covered by insurance.
A lot of my patients say, you know what, my Percocet is covered by Medicare, and that's fine with me.
For now, Masseri says with her chronic pain, it's a price she's willing to pay out of pocket.
It's not fair, you know, but it's okay to take an opioid, and it's okay to have a Friday night happy hour. That's all right.
Some research shows in states where medical marijuana is legal, doctors are handing out fewer prescriptions for opioids. In Florida, it's too soon to tell, but it's something researchers are keeping a close eye on. Dan Krauth, NBC6 News.